Asher Shavans. I'm a respiratory therapy student here at the Miami-Dade Medical Campus. And today I'm here to demonstrate to you a bronchial hygiene therapy called EasyPap. Now, EasyPap is a procedure which helps the patient to breathe a little clearer. And for this procedure, there are always indications, contraindications, hazards, and complications that we might need to take into consideration. Now, the indications for this procedure would be to reduce ear trapping in asthma and COPD patients, to avoid or to aid in the mobilization of retained secretion, to prevent or to reverse atelectasis. Also, to optimize the delivery of bronchodilators in patients receiving bronchial hygiene therapy. Now, some of the hazards for this procedure include pulmonary barotrauma, skin breakdown, and the breakdown comes from the usage of the mask, because this procedure can be used with a nebulizer and a mask. So if you have it too long, then it will cause skin breakdown. Claustrophobia is another one. Air swallowing with increased likelihood of vomiting and aspiration. Cardiovascular compromise, an increase in intracranial pressure. And another thing for the hazards would be an increased work of breathing that may lead to hypoventilation and hypercarbia. Now, the contraindications for EasyPap include increased work of breathing, and this would be caused from patients who are unable to tolerate that increased work of breathing. Untreated pneumothorax, intracranial pressure greater than 20 millimeter mercury, active hemoptysis, and nausea. Now, when you're doing this procedure, there are certain things that we have to let the patient know. Instruct the patient to take a longer than normal breath. That means you inhale all the way in, and you're going to exhale all the way out, all the while maintaining a certain level, and this level is between 10 to 20 millimeter mercury. Also, this procedure includes a duration of 10 to 20 breaths, followed by 3 coughs, and you have to repeat this 4 to 8 times over 10 to 20 minutes. All right. Also, for this procedure, at the end, you want to ask the patient to do that huff cough, and we're going to test if there's any sputum for the quantity, the color, viscosity, and odor. Now I'm going to go ahead and get my station set up. But before I do that, you always want to verify your physician order. Now, I'm checking my physician's order, and I see that the physician actually ordered EasyPap because of the atelectasis found in the patient. Now, this procedure, you're going to need a mouthpiece, which has a filter in it, a nose clip, and this clip is going to aid in preventing any type of leakage in the system. And then, of course, you will need the EasyPap device. Also, we'll connect that to either oxygen or air, depending on what's in the room. Now, I'm going to go ahead and introduce myself to the patient. Knock.
Hi.
Hi, how are you?
Good.
Good. My name is Asher. I'm a respiratory therapy student here, and I'm here to perform a procedure on you. It's just a treatment. It's called EasyPap. This is going to allow your lungs, lower airways in your lungs to open up a little bit. That way you can breathe a little clearer, and we could deliver some medication to you more easily. Okay? Now, before I do anything else, I'm going to make sure I have the correct patients. So I'm going to check for the identifiers, which is normally on the patient's wrist, and I'm checking for date of birth and medical records. Now that I've done that, I'm going to go ahead and wash my hands for at least 15 seconds, and then I'm going to don the proper PPE. Assume that I've washed my hands for at least 15 seconds. Putting on my gloves. And, I'm sorry. Now for this procedure, you notice the patient is laying flat on the bed. So for this procedure, you need to raise the patient, position them in a proper position that's more like a 45-degree angle. So I'm just going to raise my patient a little bit. I'm going to raise the bed for you. Let me know if you're feeling any pain or anything, okay? Thank you. So I'll sit my patient up. And at this stage, I'm going to go ahead and assess my patient for vital signs and breath sounds, okay? Can you lean forward a little, please? Sure. Take a deep breath for me, please. Another one. Thank you. Okay. Now that I've checked my patient's breath sounds, I've noticed that I've heard some fine crackles in the lower lobes. So this is definitely an indication for easy PAP. So I'm going to go ahead now and set up my machine. I'll connect the easy PAP to the oxygen. I'm going to turn this flow to about 5 liters. Also, the mouthpiece comes in a protective guard. It's a plastic, so you just rip it open, and all the while holding the part that you're going to put in the patient's mouth to protect it, because you don't want to have anything contaminating that field. Go ahead and connect the machine, and this is where you instruct the patient how to perform the procedure. Okay? You can just take this off since it's going in the patient's mouth now. The nose piece, the nose guard or clip, we're just going to clip it on your nose. Okay. That way we prevent any kind of leakage, so you have a full breath. Okay? So just clip this on here. Thank you. Go ahead and inhale for me, please, all the way in. And then you're going to put this in your mouth and blow all the way out. All the while trying to maintain that between 10 and 20. One more time, please. All the way out. All right, good job. Thank you very much. Now let's go ahead and take this off. All right, thank you. Now the patient has done a really good job. When you're asking the patient to exhale all the way out, you're going to maintain a liter between 10 and 20 millimeters of mercury. All right, now that I've done that, I'm going to go ahead and assess my patient's vital signs again and breath sounds, just to make sure the therapy is actually working. Lean forward for me, please. And get a deep breath in. Thank you. Once again. Thank you. Now that I've completed that, I'm going to make sure my patient is comfortable. Would you like anything else? Are you in?
I'm comfortable.
Comfortable? Okay. At this stage, we're going to ask the patient to cough. And we're going to need at least 3 huff coughs. And I'm going to just demonstrate to the patient how this goes. A huff cough is something similar to this. So could you give me 3 of those, please?
Sure.
Thank you very much. Now, if the patient were to expirate anything, we're going to make sure that the sputum collected, we're going to look for the quantity, the color, the viscosity, and the odor. Now that we've completed all the procedures, we've reassessed the patient, ensure that the patient is in a comfortable position. You go ahead and you remove your gloves. You can discard of that in the trash. Go ahead and wash your hands for at least 15 seconds. And then you go ahead and chart your findings. And that, ladies and gentlemen, that was Easy PAP. Thank you.